Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, I want to share with you a 3-step method that I share here in my office with any patient that is looking to avoid back surgery. So if you've consulted with your surgeon and they said that it's possible for you to do physical therapy or chiropractic care to see if that will help you avoid that surgery, definitely give this video a try because we're going to go over a very easy to follow at-home program that's going to focus on 3 main things. The first being improving circulation and blood flow, then strengthening our back, and then finally decompressing our spine to put it into a position that it can heal itself. Each one of these steps works differently, but they are meant to work together. Another note, this will not be an overnight success. It may take you a week or 2 of doing these exercises before you notice any results. But during that time period, if you notice more pain-free range of motion or you just feel better overall, continue with it, and I hope that it will help you avoid that back surgery. But if you're doing these exercises, especially after a week, and nothing is helping, you have severe pain or disability, please consult with your doctor or your surgeon and follow their recommendations. With that being said, let's get started and see if we can avoid that back surgery. In the first part, we're going to focus on improving blood flow and circulation to our lower back. This is an extremely important first step because by improving blood flow, we can promote faster healing, but it's also going to bring in fluids and essential nutrients to the spinal disc to help them repair. One of the safest and best exercises that you can use for this is by doing what is called the pelvic rocker or the pelvic tilt. We're going to start lying flat on our back in bed or on a floor. Have your legs roughly hip width apart, knees bent, feet flat. With this one, try to relax your body as much as you can. Don't try to tense any muscles. Take your hands, put them right on your hips. Now imagine your tailbone. What you want to do is scoop it upward like this, curling it towards your belly button, towards your spine. As you do this, you're going to start to feel that your hips and pelvis start to rock backward. But more importantly, a light activation of the muscles across the pelvic floor will work upward towards your spine. Focus on feeling it in the lower back and then hold this comfortably for a second or 2, release it, and then go in reverse. So you're going to take your tailbone and now curl it or scoop it downward, pressing it into the bed or the floor. This time around, you're going to notice that your hips rock forward. It hits the muscles a little bit differently, but again, just do this lightly until you feel it in your lower back. And then you're going to hold this for a second or 2 and then release it. But do this as a nice fluid movement of going backward and forward like this for 10 to 15 times, and with each repetition try to build into it just a little bit more. Afterwards, relax, take a breather, and then repeat this for another set or 2. So a couple quick notes about this exercise. I would try to do this at least 2 to 3 times a day. First thing in the morning is a good time, midday, and then evening or before you go to bed. But if it's really helping out, you're more than welcome to use it throughout the day as needed. And also, this is a great warm-up exercise before our second part, which is the strengthening exercises. So at this point, you should feel everything nice and loose, starting to warm up. And now let's progress into our second step. In the second step, we're going to focus on strengthening. By strengthening, we're going to build a better support system to promote healing, but also make it less likely that we have injury later on. There's 3 main areas that we need to focus on: our core, backside, and our glute muscles. So with these strengthening exercises, I would try to at least do them 1 time a day, but if they are a little bit too challenging, 2 to 3 times a week is a good start. This first exercise is called the pelvic bridge, and it's going to focus more on our backside. And the great part is we're already in position from that first step. So let's lie flat on our back in bed or on a floor, have our legs roughly hip width apart, knees bent, feet flat. With this one, we want to lightly brace our core muscles to help protect our spine. It's kind of like when somebody pokes you in your stomach, how you draw your belly button towards your spine. Mimic that and hold it lightly. And I also like to lightly squeeze my butt cheeks to activate the glutes. From there, we're going to take our hands, put them off to our side. You just want to slowly press your hips and pelvis upward towards the ceiling until your body is roughly in a straight line from your knees to your hips to your shoulders. If you're unable to get into this position because of weakness or pain, like you can only go up an inch or 2, do the best you can. Hopefully over time you will gain strength and flexibility to get into this position. But you're going to feel a lot of muscles start to fire across the core, backside, and also your butt. Try to hold this one for about 3 to 5 seconds, release it, take a breather, and then repeat this 10 times. With each repetition, try to build into it just a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, try to challenge yourself by throwing in another set or 2. With the second strengthening exercise, we're now going to turn our attention more towards our front side, over the core muscles, pelvic floor, and the hip flexors on the front of our thighs. This is called the dead bug, and again, the nice thing is we're already in position from that first step. What we want to do is lie flat on our back in bed or on a floor, but this time around, we're going to have our legs roughly hip width apart, knees upward towards the ceiling like this, knees bent roughly at 90 degrees. Take your hands, put them off to your side for support. So what you're going to do is slowly straighten one leg out like this, lowering your leg and your foot towards the bed or the floor. But the key is don't let it touch, just let it hover a little bit above. In this position, you're going to feel a ton of muscles over your front side start to fire, deep into the core, into the pelvic floor, right here on the top of your thigh. Hold this comfortably for about 3 to 5 seconds. Come back up, take a breather, and then repeat this on the other side. Just do this nice and slowly on both sides for 10 repetitions. But if it feels like you have a little bit more energy, always challenge yourself by throwing in another set or 2. This third strengthening exercise is called the bird dog, and this one is really going to help target the buttocks or the glutes, but it's also going to help improve balance if you have a lot of issues with that. We're going to start on all fours in bed or on a floor. The first movement, what you're going to do is take the top of one side's foot and you're just going to slowly bring it backward like this, kind of like just taking your toes away from you at the same time. So reach out with your leg and foot as much as you can until you feel a light stretch forming in your calf muscles that works upward towards your thigh, into your hip, into your glutes. Once you feel it around your glutes, your buttocks, into your lower back, you want to hold this and now slowly raise your leg upward so it's roughly in line with your body. You're going to feel a ton of muscles start to fire, but really focus on feeling it around the butt cheek. You're going to hold this for about 3 to 5 seconds. You're going to release it and then repeat this on the other side. Do this nice and slowly for 10 repetitions on both sides, but if it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. So let's take this one to the next level and focus on strengthening some muscles to help improve balance and coordination. So with this one, you're going to get back into that original position of lifting your leg up, but take the opposite side's arm and reach forward at the same time. So my left arm and my right leg are up. And if you have a lot of balance issues or a lot of weakness, you'll probably find that your body is going to struggle to maintain this position. So do the best you can. Hold this for about 3 to 5 seconds, release it, and then repeat this on the other side. Try to progress into this one for 10 repetitions on both sides, but again, challenge yourself by throwing in another set or 2. In the third step, we're going to focus on decompressing our lower back, that is taking as much pressure off it as possible throughout the day to put the body into a position that it can heal itself. These exercises are perfect to use anytime that you start to feel tightness building in the lower back or you're starting to feel more pain, including sciatica going down the leg, but they're really good to do after those strengthening exercises to keep everything nice and loose and make sure that if you built any tension doing those strengthening exercises, we can release that for more relief. The first exercise that we're going to do is called the wall lean. For this one, we're just going to need a wall. The general rule with the wall lean, you want to start with the most painful side facing away from the wall. So I'm going to demonstrate what to do if you have a lot of right-sided lower back pain or sciatica. But with these ones, give them a try on both sides because you may find that both sides help out, and at that point I would do this on both sides. You may find that only one side helps. The key is try to find the position that offers the most relief, and at that point build into it as much as you can to get the most relief. Find that relief position, I should say. So let's put our feet together, spaced roughly about 1.5 feet away from that wall. You're going to bend your elbow on the non-painful side, and you're just going to rest your forearm flush against that wall. I like to walk out a little bit more too, to the point where I can comfortably lean my body weight into the wall. From there, I'm going to take the hand on the painful side, place it right over my hip, and now slowly press my hips towards the wall. Do this one slowly because you're going to feel a really good stretch form in your lower back, and you only want to go to the point where it feels light and comfortable. If you start to feel any pain or discomfort, back off slightly. Now hold this for about 5 to 10 seconds, release it. On the next repetition though, you're going to move your hand up slightly, about an inch or two, and then you're going to repeat. You're going to notice it opens up your back a little bit differently. So repeat this over the whole length of your back, working upward towards your ribs, even towards your armpit. You're going to notice that one position just offers the best stretch, the most relief, and at that point, that's your relief position that you want to build into. So press into that to the point where it's a deep but comfortable stretch, and now hold it for longer, at least 30 seconds. But if you're able to, go more towards 60 seconds. And during that time period, just do nice, slow, controlled breathing. Let out as much tension as you can. Release it, and then try to do this for at least 3 to 5 minutes, broken up into as many repetitions as you like. Again, go over both sides, try to find the spot that offers the most relief and build into that as much as you can. So one of the easiest ways to decompress your back but also allow your whole body to relax is by doing what is called the relief position. So let's break this one down. We're going to lie flat on our back with a small pillow or towel underneath the curve of our lower back. It just needs to be big enough where it's going to support the curve of the lower back. You can relax into it, but it should also start to feel like there's a little bit of a stretch forming in your lower back. We also need to elevate our feet and our legs like this. So if you want to do this on a floor, a chair works really well, but you can also use the edge of a couch. If you're not able to get up and off a floor though, you can do this one in bed. Just substitute the chair with a stack of pillows. But just have that chair or whatever you're using high enough to the point where your legs are going to be able to relax, especially over the back of your thighs, over the hamstrings. So in this position, I would try to hold it for at least 3 to 5 minutes, but if you're getting a lot of relief, you can hold it for longer, 10 minutes if you'd like. Just grab a book, your phone, close your eyes and doze off. Just allow your whole body to relax as much as possible. And to make it a little bit easier, just do nice, slow, deep, controlled breaths, just in and out like this. So if you want to take this one to the next level and see if you can get some more relief, this is what you can do. Instead of keeping your back straight, slowly tilt your shoulders towards one side. Whatever side that you tilt towards, you're going to notice that a stretch forms on the other side of your back. So build into this towards the left and also towards the right. If you notice any of those positions are offering more relief, spend more time in that position, and also avoid any position that it feels like it's causing more pain or discomfort. So I want to end the video by going over some bonus tips. The first thing that I tell patients that are dealing with a back injury is let pain be your guide. If you notice any activity, movement, position, whatever that is causing more pain or discomfort, you need to modify it or cut it out completely. If you keep doing it, you're only going to build more inflammation in the back and not allow it to heal. So don't poke the bruise. The next being, and this is probably one of the most important things that you can do throughout the day to help avoid surgery, is you need to be active. I know that couch looks inviting, but it's not your friend. You need to be active because that keeps blood flow in your lower back. It keeps the muscles loose and strong. You need to find an activity that your back will agree with. And for most people, that is going to be walking. The general rule is you want to walk at least 15 to 20 minutes per day. If you're able to do more, do more. If you're not able to do 15 minutes, do the best you can. Maybe it's just walking to the mailbox and back. That's all you can do. That's your baseline. But what you want to do over time is challenge yourself a little bit more each day, because at that point it's going to build up to the point where you build a lot more strength in your lower back. Other really good activities to check out are light stretching routines like yoga and water aerobics or swimming. Really good light movements on your back. If you are going into the gym, the things that I would try to avoid is anything that's going to put pressure on your back or build compression. Generally, that is jumping motions. So if you feel like running or jogging is causing more pain or discomfort, you've got to modify it or get rid of it completely. Other two movements that I usually tell patients to stay away from are anything that deals with a lot of weight on your shoulders, so like squats or doing heavy dumbbell presses, or trying to do deadlifts. Again, find movements that are helping. If you find any movement, position, activity that is poking the bruise, you got to cut it out completely.